All right, everyone. Well, welcome and good afternoon. Thank you so much for joining our March Behavioral Health Advisory Group meeting. Happy to see everyone's smiling faces. Certainly hope everyone is having a great week thus far. So to kick us off this afternoon, if we could go around and do some quick introductions. So if you wouldn't mind introducing yourself with your name, your organization, and picking off of some of the feedback that we got last time, if you can answer, what can the BHAG help you accomplish this week or this month?
Hi, everyone. I'm Talicia Islar, and I'm with Synergy Family Services. I'm the Chief Program Officer there. I would say BHAG can continue to just, I guess, advise on like referrals and resources in the community. I feel like it's really helpful to have a group like this because, each person's coming from different places. And, I've definitely learned a great deal about some opportunities for clients for collaboration. So.
Wonderful. Welcome back. Glad to have you this month.
And I'm Margaret Fowler from Totally Linking Care in Maryland. And I would just really like to have BHAG promote the wonderful services of the Dyer Care Center, stabilization center in Prince George's County. So the more we can get them there instead of the ED, it'll help our whole healthcare system.
Thank you, Margaret. And I see Faith has joined us. So wonderful shout out there. And I know that was a question during our last meeting asking about the Dyer Care Center. So I have a few one-pagers to share with you all, and then I'm happy to connect folks offline as well to establish some of those connections.
And I'll put Faith on the spot. She did a wonderful video about what the Dyer Care Center is. So we have those as well as a PSA. So we're going to be working with the health department to get it out. But, she did a great job, and the PSA is really good too. So.
Thank you, Margaret.
You're welcome, Faith.
Hi, everyone.
Hi, Faith. Anyone else want to introduce themselves or talk about how the BHAG can support them this month?
Hello, everybody. Did I raise my hand?
Cheryl.
Okay, Cheryl Maxwell with the Black Mental Health Alliance. I'm a program director, and BHAG can help to help in reporting our assessment progress, whereby we coalition members can understand the concerns and the priorities that our residents are indicating to us. I love that we're in the process of doing this.
Thank you, Ms. Cheryl. And you were a wonderful precursor to my announcement. So for those who I have not met yet, my name is Taylor Palmer, and I'm with the Office of Assessment and Planning with the Prince George's County Health Department, and I manage our coalition and our 4 work groups. And part of my job is also overseeing the community health assessment. So for those who haven't heard of the process just yet, we are completing the community health assessment come the end of our fiscal year, June 30th. And so I'm going to put here in the chat, if folks wouldn't mind sharing with your network, we have a community resident survey that we're asking for folks to share out with your Prince George's County networks. We want to, again, get as many opinions as we can about the leading health priorities here in Prince George's County. So this survey is available to anyone who lives, works, plays, studies, or worships in Prince George's County. And it's available in English, Spanish, and French. And we will have it open through Sunday, April 6th. So I will go ahead and share those flyers here in the chat. And I'll also make sure that I am sharing that in our meeting notes.
And I think I can go next. My name is Denise Albright. I work with the Prince George's County Health Department. I'm a program manager within our Behavioral Health Division. And there are a couple of things. One, I want to make sure I'm able to join a community care coalition or coordination group this month. So definitely need help with that. I've already connected with Tornisha, but I just need to follow up and make sure that that is actually executed. That's one. Two, we have a National Prescription Take Back Day that'll occur on April 26th of this month. This year, we're doing it in Hyattsville, and it's all about trying to reduce the deaths and overdoses, especially around opioids in our community. We actually have an epidemic occurring right now with overdose deaths. And last but not least, I will take your link and then be able to share it as well. We have a partner meeting coming up on April 3rd that we are working on now, and I'll be happy to share the link for the community needs assessment as well there. So thank you.
Thank you, Denise. And Kimberly, I'm going to pick on you. I know you're new to the group. Would you mind doing an introduction?
No, I don't mind at all. Good afternoon, everyone. My name is Kimberly Walker. I'm the co-founder of Infinite Wellness Maryland. It's an outpatient private practice. And so I am here because we are new in the community and I'm really wanting to connect and collaborate and not necessarily reinvent the wheel. And so I'm just excited to be here today.
Wonderful. Thank you so much for joining us.
I'll chime in. My name is Shatia Blunt. I own a private practice as well, I Am Me LLC, and I don't have an ask for this week or month, but should have one next month. So thank you all.
Wonderful. Thank you, Dr. Blunt. Anyone else?
Good afternoon, everyone. My name is Wade McLaughlin. I am Program Director at Empowering Minds Resource Center. And what can BHAG help to accomplish this week or this month? Just continue collaboration and opportunities for collaboration with other providing agencies to be able to provide supports and services that are needed in our communities.
Thank you for joining us.
Good afternoon, everyone. My name is Jasmine Jones-Edwards. I am the Director of Business Development and Referrals for Volunteers of America, Chesapeake and Carolinas, the Hope Center. What can BHAG help us with? We are in the process of launching our youth adolescents SUD group. So, of course, I will be sending out flyers to share that information with everyone soon. So getting that information out to the community will be very helpful.
Wonderful. Thank you, Jasmine.
Good afternoon, everyone. I'm Courtney Reed, nurse practitioner in health and wellness, previously in behavioral health, but I am working on implementing a program called family-based intervention. And although it is targeting a weight loss lifestyle modification program for family and children, there's a big behavioral health component. So I am here to just assess what resources we have in the community.
Thank you, Courtney. And I see Tanisha is on. Tanisha, anything you need from CAP region?
Hello, everyone. My name is Tanisha Whitlock. I am a community health manager at CAP Region Health in Largo. I'm a licensed master social worker as well. And I'm here to, what you guys can do for me this week or this month is just continue to share resources, because we are looking to collaborate and partner with organizations in the community to better serve the community in like the behavioral health segment. Like we have healthy eating programs and diabetes programs, but we're really looking to collaborate and partner with community partners to leverage the behavioral health at CAP region. So if you guys have any opportunities for us, please reach out to me. We are actively looking for ways that we can partner with you all.
Great. Thank you, Tanisha. And if you could put your contact information in the chat, and certainly hope that the first session, that mental health training that you all did, hope that went well.
Yes, it went great. Thank you so much for sharing. Actually, just to give you guys some kudos, we've actually filled up all of our classes from sharing the the link with you all. So we're really grateful for that. And that's really good news. So thank you a lot, Taylor, and thank you for this group for sharing that link.
Absolutely. Thank you so much for sharing with us.
Mhm.
And Dr. Coleman, I think I cut you off earlier.
No worries. First and foremost, good afternoon, everyone. This is my first opportunity to participate in the Behavioral Health Advisory monthly meeting. So I am excited, first and foremost, to learn what's happening and how I can partner and collaborate with the wonderful work that is already taking place in Prince George's County. Um, if I had an ask, my ask would be that we would share about our Empowered Parent Academy. The EPA provides a deep dive solution to help parents navigate the educational system. This is something that we have been doing since 2021. However, with the current uncertainty, parents of students with disabilities, students with learning impairment, students with mental health illnesses are very concerned about if their students are going to continue to get the supports that they need, especially by way of an IEP or a 504. And if so, how do they go about accessing those services? If and when the Department of Education is restructured. And so our Empowered Parent Academy literally sits with parents and takes a deep dive into that conversation, helps them to understand where the resources are at the state level and the local levels, and how to advocate for their children to make sure that their needs are met so that they can access the general education curriculum.
Thank you, Dr. Coleman. And certainly any material that you have, please add it to the chat, and then we can also chat offline as well about any resources that you want to get out to the work group, and also talk to some of our other members in the coalition about your efforts.
Thank you. I appreciate that.
Absolutely. Alrighty, well, thank you everyone for your introductions and for giving us an idea on how we can best support you. As always, please do let us know between the meetings if we can support you or your organization in any way, shape, or form. Always here to connect folks behind the scenes. And so for our agenda today, we are going to continue our planning discussion from last month. So I know several of us were out last month at a training retreat, and so want to do a quick recap of the monthly meeting so we can see some of the ideas that were suggested for our 2025 planning and some of the BHAG goals that we want to accomplish throughout the rest of the year. Then we will review those areas of focus and figure out where we want our priorities to be as we move forward. And then lastly, as usual, we will wrap up with our community announcements and upcoming meetings. So first, in our last meeting, we asked the question, what new or emerging challenges have we observed in our community that require our attention? And so as we started talking through this, we learned from one of our members, she expressed that more programs are available in Prince George's County for individuals experiencing substance use rather than dealing with broader mental health challenges. And I know she mentioned specifically highlighting housing insecurity for those folks, so needing supportive housing after crisis. And to be able to stay in that housing through their recovery so they have that stability. But it was acknowledged that those resources more so exist for individuals who may be experiencing challenges with substance abuse. And so wanted to continue that discussion today. If anyone has any ideas, I know we have some folks who are involved in that crisis center. If you have any ideas for any supportive housing resources in the community, if you could lift those up. And then second, we talked about emerging stressors that have come up for our community here in Prince George's County, and probably alike for many folks across the country who are dealing with stress from the unpredictable nature of job loss and needing additional resources to support them during these times, including rental assistance, food assistance, those different needs, those different resources to support their social needs, especially as we see unemployment rates go up and sudden job loss. Wanted to give a moment. Were there any other emerging challenges or any reactions to any of the information that was discussed in our last meeting? And were there any emerging challenges that anyone wanted to lift up? And then lastly, were there any resources that folks wanted to mention today regarding that housing concern for folks post-crisis? I know in our last meeting, someone had mentioned that they're having to refer clients to seek out care in Baltimore for those post-crisis housing needs. But are there any resources in Prince George's County that folks are aware of that they would want to note on the call?
Hi, yes, I did want to know, here at Volunteers of America, one of the programs that we do offer is the rehabilitation resident program. And of course, that is for individuals that do suffer from various mental health diagnoses. So I can put my email in the chat, but that's something that we were looking to connect with the Dyer Center with to be able to offer that if housing is one of the issues for consumers as they are discharged.
Thank you, Jasmine.
You're welcome.
Are there any other resources or folks from the Dyer Care Center? Are there any resources that you've been referring folks to in terms of their housing needs?
With regards to housing, we've had some challenges with referring within the county, especially when it comes to women, you know, finding shelter. So we've had to refer out to DC in certain instances. Because some of the programs we have here would also have criteria that have like eliminates certain people's. So for instance, if the person is homeless but they don't have substance abuse history, for instance, some programs will not take them. Or if they have significant medical conditions, then some programs will not take them. So we've referred to Baltimore, to DC, sometimes to other counties if the residency requirement is not in place for that person. It's also hard to find housing for people who are pregnant.
Thank you for that, Faith. And I will continue to keep a pulse on this with our community care coordination team and talking with some of our folks from the Department of Social Services to note any resources that we could bring up in this work group. And Denise, I see what you put here in the chat for, is it UCAP in Capitol Heights?
Yes, it is. UCAP in Capitol Heights, they have been able to service families. There's a separate men's shelter, but for them, they've been able to service families, and they put them onto a track where they engage in additional services, and they kind of support them through like a 90 or 6-month program where they're able to support housing as well. And they have multiple families within the unit itself. It's a pretty large building over there in Capitol Heights or Fairmont Heights area, I think it is.
Thank you for that, Denise.
Yep.
And then any additional context that folks wanted to give about the emerging challenges that they're seeing in the community in terms of sudden job loss and some of the challenges associated with that job loss, including the need for rental assistance, housing insecurity, and some of the challenges that are associated. And when we started talking about the innovations that we could implement here in Prince George's County to address those emerging concerns, some folks had uplifted creating resources that highlight coping strategies for those individuals who are experiencing that insecurity or that uncertainty or unpredictability after that sudden job loss. And then going through and again noting some of the programs that may be available to those folks if they are experiencing a loss in their employment, and uplifting some of those resources that could be used to support their social needs. Was there anything else anyone wanted to add in terms of the resources for helping to address coping strategies or different resources for folks who may be experiencing that unpredictability?
Yes, I recently, this weekend, let me come on the camera. I attended the NASW conference, joint conference with DC Metro and Virginia. It was combined. And there was an organization there by the name of Act Now for Mental Health. I don't know if anyone has heard of it, but they offer free therapy for anyone ages 17 to 32 in DC, Maryland, and Virginia. And also they have groups for anybody, like post-election support groups. And there's two other groups that they offer for free. No cap on sessions or any of that. And so that may be a resource that folks may be able to use, especially for those who may have lost insurance that prohibits them from accessing, certain mental health resources or behavioral resources. So it's Act Now for Mental Health. It's anmh.info. So I figured I'd share. Thank you.
Thank you, Dr. Blunt. And are there additional resources that folks have identified in the past few months that they wanted to lift up? And now I'll pose the question, given the communities that you all work with, is this something that you all would be interested in taking on as the BHAG to start locating these resources and put together some sort of toolkit or some sort of accessible document? Ms. Cheryl, I see your hand.
Taylor, I'm sorry, I missed the statement that you just made, but for anyone wanting the location for UCAP, the United Communities Against Poverty, I'll put this in the chat. They're at 1400 Doewood Lane. But you know what I'm finding difficult, Taylor, is I've got several persons with mental health issues that are receiving services with respect to medication on an outpatient basis, but these people are homeless. And the programs that I thought would offer some shelter for them, or what, for instance, pathways to housing, would offer them an opportunity to be put in temporary housing, if nothing else. These programs are no longer offering that type of housing assistance. Again, I know that they exist here in the county, but if anyone could put in the chat a facility that they are aware of, I would appreciate that. It would be just a matter of scratching my memory here, but I will put what I found in the chat as well for anyone wanting further information regarding UCAP.
Thank you, Ms. Cheryl. And so in considering, again, those populations that you all are seeing, is this a resource that you think would be useful to the community, or is there one already out there that folks are utilizing to, again, be able to support communities who are experiencing job loss or increased stressors due to insecurity or unpredictability?
Taylor, are you asking for it to be for an access for people to come to, or for us to just have it an internal resource? Like the general community?
However the work group is feeling, I think last meeting when we were talking about it, it was something that would be available to the community. But if we wanted to pilot test it internally and then release it externally, we could do so as well.
I think if we're going to do it, we maybe should try it internally, because, just like what Cheryl said, sometimes we have something, but then when they go to use it, it's like not quite what it doesn't serve the purpose. So I don't know. That would be my recommendation. I mean, I think it would be good to really start putting that together for this group, because then they have so many touch points and can like fine tune it and say, hey, this isn't working, or hey, did we, it doesn't do this, it doesn't do that, or it does this, it didn't mention it. So I think it might be a good way to start doing a clearinghouse of information. So I've just been hearing a lot of new things, even today with some of the new members, and some things that, like the Act Now, that is something that I think would be helpful for everybody to know and be able to almost pass out in, cards to anybody that is feeling like they could use that and don't have the resource. So I think it would be I think it would be a good opportunity for this group to sort of start compiling it and see what it looks like. I don't know what everybody else thinks.
Any other thoughts? I know we have some of our private partners on the line. Would this be a useful resource for you all? Are there any specific components that anyone would want to see in some sort of resource inventory? I know we talked a lot about housing resources, but are there any other resources that folks would want to focus on or make sure that we include in that resource inventory?
Taylor, I apologize. I'm new to the conversation, but have we already identified that 40% of I know of Prince George's County students are Spanish speaking. So have we already covered that the need to make sure that we are providing this in both English and Spanish?
No, we have not, Dr. Coleman. So this is a new initiative that we're talking about taking on. So it was mentioned last meeting as something that the work group would be interested in considering. So this is our first discussion of what that may look like and what that may feel like, but certainly something to consider, especially as we would transition it to external use.
I'm sorry, Taylor. I know it's quite quiet. And I'm not contributing. As a private practitioner, I find that most of my clients are pretty resourced, so I don't have much to contribute. I want to, and I'm here really trying to think of something. I will be open to the initiative, but I can't think of anything right now. So just wanted to manage the awkward silence.
I appreciate it, Dr. Blunt. What I can do, we have 2 interns who are starting next week to support the coalition, and one of their projects, I want to make sure that they are supporting the BHAG. And so what I can do is I can ask them to conduct a brief environmental scan to take a look at any emerging resources that are coming out of some of our partnering jurisdictions. I know in our last meeting, folks mentioned Montgomery County's resources and some of their inventories. So we can do an environmental scan, take a look at what's out there, and see if that could be a baseline for what we could implement here as a BHAG. But of course, think about in the populations that you're serving, the services that you're providing, if there are any resources that you think would be helpful to share with the community, please do keep those in the back of your mind. And then any important components or any gaps that you're seeing in your services as well, please note those as we move forward with what this resource may look like. Alrighty.
Taylor, I've got one more that I would hope that we might consider. I don't know if we have partnerships with our community stores, our Giants, Safeways. Let's see what they're. Oh my gracious, Lidl, Lidal, other stores. But I was thinking about the incident where the senior citizen was just so dismayed when she had this carton of eggs that she had to pay $13.99 for. And I don't know if those community stores have a list of resources that people can seek out when they are having difficulty feeding themselves and feeding their families. And I'm wondering, is that at all possibly a project that an intern might be interested in doing?
Yes, thank you. Thank you for that, Dr. Cheryl. Something that we've certainly thought about with our community care coordination team. And I think we did a presentation to you all back in December, I believe, regarding Find Help and accessing that resource and being able to take a look at some of those community programs that are in the Find Help platform. So that would be something that I'd love to revisit with the CCCT and taking a look at if we could get out QR codes or links to Find Help so folks can go in and add their zip code and be able to access some of those local pantries, and something that I can also discuss with our partners over at Giant with their food pharmacies and such.
Well, and Taylor, didn't they have like and this is maybe a couple of years ago, a geo mapping of like where all the food pantries were, and I think the Public Health Innovations was doing it or something like that. I don't know where that ever ended or landed.
Yes, it is actually powered by Find Help.
Oh, okay.
But definitely getting a list of, all of our resources that we have with 211 with Find Help. And again, just being able to put that in the hands of as many community residents as possible, for those folks who may not be seeing community health workers or case managers, to make sure that those folks aren't falling through the cracks. And in your example, Ms. Cheryl, you talked about an elderly woman. So we also have to consider, how digitally literate are folks, and will they be able to access some of these online resource inventories? So something for us to consider moving forward.
And I'm thinking that someone may not be carrying a reference material around with them, right? So if it's possible for it to be posted, or if there's someplace in the community store that it might be found or they could be directed to, that might be another way of making certain that people can access information in real time.
Great. Yes. And anyone who's interested in joining our community care coordination team and continuing that discussion in particular, please do feel free to put your email in the chat. I see Denise has acknowledged that she would like to join the work group. Happy to extend an invite to others as well. And then next in our last meeting, oh, I'm sorry, go ahead, Jasmine.
No, I did want to add that Whole Foods is another major grocery store that will do donations as well to organizations. We usually get food items from there, and then of course we distribute it to our consumers. So they're another great donor.
Wonderful. This has my head spinning of what a wraparound service could look like. Denise, I'd love to have a chat with you, and I see Dr. Somerville's on the line as well, to see in some of our upcoming events if we could invite some of these food distributors who give out donations, and make that a one-stop shop for some of those resources.
I'd love that as well. With our April 26th National Prescription Take Back Day event, we are adding a pantry feature to that event, as well as inviting other vendors in terms of screenings and other health information tables as well. It would be much larger than we've had in the past. And so this is our way of extending that reach out into the community and also supporting additional languages as well. So this year we'll be in Hyattsville, working with the faith-based organization at First United Methodist Church, and we'll include all of that there. I have added something into the chat there to promote that with our promo that we have going on there. But if anybody is interested in participating and or just simply coming out to kind of see what it's all about, we'll certainly welcome you as well. And certainly, Taylor, we can talk additional off the line.
Taylor, I just wanted to quickly say, count the Black Mental Health Alliance in as it regards to reaching out to our community resources, particularly our stores.
Awesome. Yes. And as we promote the importance of somatic care, I think, this is the mindset that we all need to be in. So in terms of any community events that you all are having, or any events that, again, you're experiencing someone one-on-one, there's any way possible that we can have these partners available at your events, I am happy to work with you all to connect to some of these food distribution centers or some of these food pantry partners, and coordinate for your events. So please do let me know how I can best support you, and let me know of any upcoming events. And then next, one of the ideas for something that the BHAG could focus on moving forward is moving from our discussion of the quantity of care, of mental health care in Prince George's County, and really taking a deeper dive into the quality of mental health care. So Dr. Blunt, I know I am not doing your words any justice here, but I believe in the last meeting you raised the question of how do we define quality of care, and what does it look like beyond those standardized metrics of patient satisfaction. I must admit I did a quick scan of some of those resources, and I had some issues finding some different scales and different scores, but would be happy if you had any additional context that you wanted to bring up to the group, or if anyone had any ideas on how we could move forward with quantifying quality of care.
This is Dr. Blunt. I wasn't prepared to go into more depth, I guess, today. But I will say that I'm not sure. And wondering, I guess, if there is no standardized definition currently, like for the county. Is there that you know of, Taylor?
I'm going to have to defer to our folks with the health department, with the behavioral health division. I am not aware of any scores beyond just a patient satisfaction score. So I don't know between our health department or some of our hospital partners if there are specific measures that they're using for mental health services.
So I would just probably defer to the SAMHSA definition for quality of care for behavioral health. As a standard definition, I don't think that we have a separate one specific to the health department, but I think it would be a really great starting point for BHAG to consider. And then potentially we could do some work around contextualizing what that definition looks like for the residents of Prince George's County.
Mhm.
But I'll copy that, the SAMHSA definition in the chat.
I think that we could, I don't know if this is too ambitious, but we may want to maybe even develop a survey or maybe some kind of community focus group or some kind of on the ground activity to gather information from recipients of care to see how they define quality. And we can do like a small qualitative analysis, to see what words or themes emerge out of the conversation, and then probably maybe compare that to what we see in the definition, in the SAMHSA definition. So that's a very preliminary idea that would, of course, take more planning and coordination, but just to leverage this community participatory and community engagement element of things. Recipients will be able to tell us what they think is quality care and what they do not, recipients of care.
And Dr. Blount, I think that plays into the last element of this definition of positive patient experience. And we thought about that at the health department from a very rudimentary perspective, just sort of like a thumbs up, thumbs down sort of reaction to a program or an event, or, it depends the level of participation, but being able to start to collect just a really simplified, oversimplified measure of what the experience of clients was for any of our behavioral health programs. So that would be one idea for a starting point. But if we wanted to take it a step further and have something consistent across all of the BHAG members, I think that would promote really interesting data outcomes.
I agree. My only thought about the thumbs up, thumbs down piece is that there's so many components to care, and I think it would be worthwhile to be able to distinguish between those elements, right? Because there's the administrative portions of care, and then there's the clinical portions of care that all contribute to overall quality of care. So I think, even like finding a way to delineate between those two would be very fruitful for us as a coalition, so that we could intervene appropriately if needed or celebrate appropriately, depending on what the results say.
Absolutely. I agree with you 100%. Thinking about where we are and ramping up to where we'd like to be, it seems like a potential starting point maybe, but definitely not the end measure that we'd want to use long term.
For sure, for sure.
Any other thoughts about a standardized measure or any nuances that we would want to consider for a measure here in Prince George's County?
I think that, we speak a lot about the diversity in the county as well. So we want to make sure that in any information that's captured, that hopefully we will be able to distinguish between the various communities that we have here as well, since this is quite diverse as well. So that's my only thought.
Dr. Blunt, and I'm thinking what a pilot test may look like with the behavioral health division, and taking a look at some of our internal programs and asking the questions, going through the process that Dr. Blunt was talking about with some of that qualitative data analysis, being able to hear as many words from the community as possible, and then being able to use our preliminary results from that to then expand to some of our other partners on the BHAG as well.
Yeah, I think that would be good. I think it could be done with very minimal resources and probably leveraging some of the partnerships that were discussed earlier to make sure that participants, if they are already, coming to a local space, maybe there's food provided, et cetera, and there's a, 90-minute focus group with informed consent where, we have some prompts and then we just, see what words and phrases and themes emerge. I'd be very happy to be a part of such endeavor because I'm quite interested in the quality of care. So
thank you, Dr. Blunt. Wade, I see your hand.
Just waving to an individual leaving the office. My apologies.
Oh. No worries. All right. Any other thoughts about that quality of care measure or any other ideas for a starting point?
Taylor, you might want to consider checking with the local behavior authority to see if they have a definition because they monitor a number of the providers in the county.
Gotcha. Thank you, Dr. Somerville. I will touch base with Amani and Sharice. Courtney, can you hear us okay?
Taylor, I can, but I think I have poor connection, so I'll just type it in the chat.
Okay. Wonderful. Thank you, Courtney. Alrighty, well, I will follow up with the LBHA before our next meeting and convene with the Behavioral Health Division so we can start thinking through what this definition from SAMHSA may look like and get you all something to react to, and we can start thinking about breaking this down to very specific benchmarks and what we would want that final product to look like. But in the meanwhile, if anyone has any ideas for any specific elements, in knowing the populations that you all work with, that you serve, please do take note of that and bring that up in our next meeting. Any other thoughts or any other additional points that anyone wants to bring up in terms of innovations that we could bring to Prince George's County as the Behavioral Health Advisory Group? All right. And then next, in talking about enhancing the experience of all of our volunteers who volunteer their time to the Behavioral Health Advisory Group, we want to make sure that these monthly meetings are as beneficial as possible for you all to get out your resources, to be able to troubleshoot and talk about any pain points as we try to better streamline behavioral health services here in Prince George's County. And so to do so, I know we brought up better integrating the work group and ongoing behavioral health research in Prince George's County. So I've reached out to a few of our local community colleges and universities to learn about any initiatives that are going on at the undergraduate or the graduate level. So I will keep you posted on all of that. And then Miss Cheryl also made a connection to some folks from Johns Hopkins to talk about some research efforts that are going on in Baltimore between Prince George's County. So I will keep you all posted on any initiatives that I hear of. But for folks who were unable to join us on the call last month, if anyone has any ideas for any ongoing behavioral health research in the county, please do put that in the chat. And then next, we talked about, again, being able to build connections in the BHAG. And so we started talking about the short member introduction. So taking a few minutes during each call to do a broad presentation of your organization's services and coming prepared to discuss the two questions of how can I help you and how can the BHAG support me. So you all saw that exercise that we did in the mindful minute of this meeting, but implementing this moving forward so we can all get to know one another and get to know the wonderful services that everyone is providing. So with that being said, I went ahead and put together a sign up genius for each of our monthly meetings moving forward. So if folks would like to sign up for a 5-minute block, we'll just keep it to about 5 minutes. If you could come prepared to talk a little bit about your organization, high-level overview of the services that you provide, any specific populations that you service, and then come prepared to discuss how can you help organizations on the call or and how can the BHAG support you as an individual or as an organization. We'll have about 2 presentations a month, so I have enough time slots set up for the remainder of the year. So do let me know if there's a certain month that would work better for you, and we can talk about expanding and having a few partner presentations. But hopefully this will just be, again, in a formal way to introduce folks to the BHAG, especially for our new members, and to hopefully build connections that will continue to build beyond just the scope of these monthly calls. So I will be sure to send out the link to you all in the meeting notes to sign up on the Sign Up Genius. And I see here in the chat, Denise Dunbar had put the ECHO project in partnership with Kennedy Krieger, can certainly follow up with those researchers. I know they came and spoke to the BHAG a few months ago and see how that implementation is going here in Prince George's County and if there are any lessons learned that they would want to share with the BHAG. And then, thank you, Courtney. We'll certainly bring these metrics together for our ongoing discussion. And I appreciate you bringing up care coordination. I think that relates very well to the earlier resources that we were discussing in terms of rental assistance and the need for food pantries and food resources. All right, and then as promised in our last meeting, we raised the question of who folks would like to hear from moving forward. So if there were any partner presentations we could uplift, and the Dyer Care Center was mentioned. So wanted to be sure that I put out the one-pagers to promote the services provided at Dyer. So I will be sure to include these in the meeting notes. But for folks who were unable to join us last month, were there any other partners that you all would want to hear from or any other resources that you would want to highlight moving forward in our monthly meetings?
Not at this time, Taylor.
Thank you, Dr. Coleman.
And just wanted to add, if anyone needs the flyers, the Dyer Center, soft copies, I know you have some of them already, but they can send me an email. I'll put my email in the chat, and we can drop off paper copies as well as send you the electronic version.
Thank you, Faith, because I think I've seen before where you all have flyers and then you also have like foldable pamphlets.
Yes.
Okay.
So we have information about the whole crisis continuum. So not just Dyer Care Center, but 988 and mobile response team. And that can be a good resource.
Wonderful. Thank you, Faith. And that reminds me, anytime that folks are doing their partner presentations in a future meeting, please do come with any materials that you would like to share. We can post digital copies and then help folks arrange if you want some printed copies as well, in any of those central places in the county where we should be featuring that information. We can talk about how to get that information available in those spaces. Alrighty, and wanted to move into another resource as we start to talk about partner connections. So for folks who are not aware or who may be new to the coalition, we have a site, it's called PGC Health Zone. That is where we store all of our coalition information. It has some wonderful data resources as well. You can build out different data reports, take a look at local level indicators. And so in our last quarterly meeting last Tuesday, we went over an overview of PGC Health Zone. So I will share that recording with you all so you can take a look at the resources that we have on our website. But a specific partner resource that I wanted to lift up to all of you, we have a calendar of events that is active for all of our community partners to use. So you can go to our website, PGC Health Zone, and go to one of our tabs and add your community events. So we want to make sure that we are getting your events out to the community. And so please go in and add any, you can add a one-time event or any reoccurring events to our calendar. And that is where I pull from for many of our newsletters and various community announcements. So make sure that your events are added there if they are available to the community. And then this was also a question that came up in our last meeting that I wanted to make sure I followed up on. We have a behavioral health provider list that is active on PGC Health Zone. We are working to integrate Find Help as well, but I know it came up. Some folks were interested in accessing the provider list. So if folks would like to be able to access that resource, I included our contact information for the person who is upkeeping that resource if folks would like to add their behavioral health resources to our provider list. So again, I will make sure that all of this information is included in our meeting notes. And with that being said, is there anything anyone wanted to discuss following up on our last meeting, or any other priorities that folks wanted to discuss in terms of what the BHAG is going to take on next to complete 2025?
Taylor, I just want to thank you for always bringing organization to this meeting, and thank you for everybody who came today. You know, this is how we stay connected, and learn something new every month. So I just want to thank everyone for coming and participating.
Thank you, Margaret. We'll go ahead and transfer over to our community announcements. So first, wanted to announce the Office of Minority Health and Health Disparities with the Maryland Department of Health is hosting a grant writing workshop on Tuesday, March 25th from 10 a.m. to 1 p.m. This is an online session that I will share the registration link with you all for anyone who is interested. And they'll also have another event building on the fundamentals on Wednesday, June 11th. So be sure to get this information out to anyone who is interested. Next, our summer youth enrichment program here in Prince George's County is open for applicants. So any youth ages 14 to 24 are eligible for this opportunity. There's a $500 stipend for work programs running from July 1st to August 8th, and applications for this program close March 31st. So wonderful opportunity to get exposure to different careers and to be able to build those professional development skills over the summer months. So please share this with any of your youth networks. Next, as I mentioned earlier and put the flyers in the chat, our community resident survey has launched. Again, this is an important survey for the community to inform the community health assessment and to establish the health priorities that the health department and many of our community partners will focus on for the next several years. So please do share that with your community networks. Again, available to anyone who lives, works, worships, studies in Prince George's County, and it is available. The survey is translated in Spanish and French. So please share those flyers with your networks, and do let me know if you could use a printed flyer. I can come to your organization, come to your site, and make sure that you all have paper copies to share with your community. Next, happy to share a mental health and addiction treatment conference coming up on Tuesday, April 29th at the Baltimore Convention Center. Shared this with you all about 2 weeks ago, but I'm going to put this in our meeting notes again for anyone who is interested. I believe they're having some special registration prices the earlier you register. So I will share this information with you all for anyone who is interested in attending this conference. And then next, happy to share from our local behavioral health authority, the Spring into Wellness Behavioral Health Expo. There's a call for vendors. So I will share with you all a short form that they're asking organizations to complete if you are interested in participating in the event. So I will share with you that form, and that the deadline for your application is April 30th. And you'll just email it to the LBHA's email address. So I will be sure to provide all of this information in our meeting notes, but do also save the date on your calendar for Saturday, May 17th from 10 a.m. to 2 p.m. for this event. And next, Nina, I will pass it over to you to discuss the Extreme Risk Protective Order Liaison Program.
Yeah, absolutely. I'm actually going to introduce the project director who's on the call, Brittany Vasquez, to talk about the program and the NOFA or ERPO funding for implementation partners. And that is closing later this month.
Hi, everyone. I'm Brittany Vasquez. I'm program manager at the Health Department for Behavioral Health Division, and also project director for our ERPO Liaison program. So just to give you a quick background, extreme risk protective orders or ERPOs are petitions filed through district court for anyone who has presented a danger to themselves or others, and this allows for the removal of their firearms and ammunition, and it also prevents them from being able to purchase firearms and ammunition while this order is in place. So the ERPO Liaison Program, the funding was awarded to us through the Governor's Office of Crime Prevention and Policy. So we're very excited about implementing this program into the community because it will allow for collaboration to create a task force to discuss violence in the community, trends in ERPOs, and how we can better support our community members. And it's also going to give us an opportunity to educate the community and our partners in the community on what an ERPO is, how to file one, and what supports are available for people impacted. And then we are also going to be able to connect people to services. So we are collaborating with our county's crisis continuum effort, so that we can utilize their network of providers to refer people to, so that people impacted, whether it's the respondent or the petitioner, can receive behavioral health treatment and other supports such as victim supports and legal supports as well. And there is an opportunity to, through GoCap again, to support our initiative. So nonprofit organizations can apply. There are two categories. One of them is preventive. So some people are interested in doing preventive work with this population. And then there's also opportunities to help us to expand in our outreach and bringing awareness to the community and training as well. So if you have any questions, my contact information is there at the bottom of the screen. I'll be happy to address any questions or concerns you have.
Thank you, Brittany.
Thank you.
Any immediate questions or reactions? All right, well, I will be sure to include your contact information, Brittany, in the meeting notes, and folks can follow up. And I believe there's an upcoming deadline, correct? Is it next week or the following week?
Yes, the 28th. So if you are interested in applying for this grant, reach out to me so that we could discuss how a partnership could work with this initiative.
Great. Thank you, Brittany.
Thank you, Taylor.
All right, well, go ahead and open up the floor if there are any community announcements, any upcoming events that anyone wants to mention or highlight. Yes, Ms. Cheryl.
For not a community event coming up, but we're approaching vacation times, and as we have done typically, we recess usually during the months of July or August. And I'm just wondering, might it be something that folks want to do a in-person meeting before we kind of shut down for those months? I'd like to see some folks. I mean, your faces are great here, those whose faces are on camera, but to be able to see one another in person and just to say it's been good working with you, and we're looking forward to the next season coming up, 2026. Is that at all anything that anyone would want to do? I know I do.
I know I do.
Yeah, I think that would be a good idea, Cheryl. It's always nice to get, hugs in, really.
Yeah, really. And I don't know about everybody else, but for each face that I see, your name is plastered across. So you really don't get to see the face of the person that you're looking at. It would be nice to see you guys in person.
Yeah.
That'd be great. Yes, I will start taking a look at our calendar and see if we want to make one of those summertime monthly meetings an in-person option, and then book some space between one of our facilities here in the county. Any additional community announcements? All right, well, I will be sure to get out our meeting minutes, but I would say folks can go ahead and take a look at your calendars and think about when you would want to do a partner presentation. I will send out those, the registration link so we can start those up at our April meeting. Again, just a very short, under 5-minute presentation, talking a little bit about your services. Bring any materials that you want to share, and then figure out if you have any asks that you could use some assistance with from the BHAG, or how you can support the BHAG members. And we look forward to starting those up next month. But otherwise, we will see everyone back on Wednesday, April 16th at our usual hour. But of course, as always, please let us know if you need anything in the meantime.
Thank you, Taylor.
Thank you, Taylor.
Thank you, Margaret.
Thank you.
Thank you
Have
so
a nice
much.
evening, everyone. Bye-bye.
Enjoy the sunshine.
Yeah, no, I think you're incredible, Taylor. Have a
are.
wonderful afternoon.